Hey YouTubers, welcome to my budding YouTube channel. Today we are going to learn something. Let's learn about sarcoidosis.
Let's learn. Sarcoidosis. It is a non-caseating granulomatous disease of the lungs, but it is actually multisystemic. The etiology is unknown. It could be autoimmune or it could be a sequelae to Mycobacterium TB infection, Papillonibacterium infection. It mainly affects the lungs, causing fibrosis and thus leading to restrictive lung disease. Such patients come primarily with cough, shortness of breath, but sometimes be asymptomatic. They could be having weight loss, hepatosplenomegaly, lymphadenopathy. When we inhale an antigen, it reaches the alveoli and there is oligoclonal proliferation of CD4 T helper cells, and these CD4 cells secrete interleukin-2 interferon gamma. The interleukin-2 is responsible for T cell proliferation. Interferon gamma, it causes increase in IgG, the immunoglobulin secretion, and polyclonal gammopathy. Interferon gamma activates macrophages and induces fibrosis, leading to restrictive lung disease. This is a picture of a fibrosed lung. Then the activated macrophages also produce TNF-alpha, leading to a non-caseating granuloma. The activated macrophages also synthesize 1-alpha hydroxylase and converts inactive vitamin D to active form, leading to hypercalcemia, and there forms calcified bodies which are seen in the granuloma called Schaumann bodies. The granulomas that are formed are seen in almost all organs, but mainly lungs and lymph nodes are affected. On microscopy of sarcoidosis, we can see asteroid bodies and Schaumann bodies. Asteroid bodies are seen in another condition, which is that asteroid bodies are seen when we look at the biopsy image of sporothrix infection. It causes subcutaneous mycosis. This is how an asteroid body looks. So Schaumann bodies are calcified bodies, and the calcium deposits as calcium phosphate. This calcium is stained with alizarin red and phosphate is stained with von Cosa. Lung is most commonly affected and the staging is called scaling staging. So according to that, stage 0 means the lung is normal or there is no chest abnormalities. In stage 1, there is bilateral lymphadenopathy, bilateral hilar lymphadenopathy without parenchymal infiltrates. In stage 2, there is stage 1 plus pulmonary infiltrates. In stage 3, there is only lung infiltrates, and in stage 4, there is pulmonary fibrosis. Now, sarcoidosis may present in other forms. Lupus frenio. This is a term for skin involvement in sarcoidosis. It affects the bridge of nose, eyes, cheeks. Then there is Lofgren syndrome. It is a syndrome of diseases consisting of erythema nodosum, arthritis, hilar lymphadenopathy, uveitis, and the prognosis is actually good. Then there is uveo-parotid fever, also known as Hereford-Waldenstrom syndrome. In Hereford-Waldenstrom syndrome, like seen in the image, the patient has uveitis, parotitis, fever, and 7th nerve palsy or facial palsy. What are the investigations? We have to do a CBC. On doing CBC, we observe lymphopenia because all of the lymphocytes sequester in the lungs. So in the blood, lymphocytes are seen less in number. Then angiotensin converting enzyme is found to be elevated as granulomas produce ACE. So in sarcoidosis, the level of ACE is found to be elevated. Then calcium is seen to be increased. So as more active vitamin D is formed, calcium is synthesized more. So calcium level is found to be increased. Then on chest X-ray we can see 1, 2, 3 sign or the Garland sign. So there is enlargement of the right paratracheal lymph node. Bilateral hilar lymph nodes are also enlarged on the chest X-ray. If only unilateral hilar lymph nodes are enlarged, then we should think about TB. So as seen in this x-ray, we can see right paratracheal lymph node being enlarged and bilateral hilar lymph nodes are enlarged on the x-ray. Then we can take a CT chest to look at the pulmonary involvement and lymph node enlargement. Then on bronchoscopy, on taking BAL, we can see lymphocytosis. As all the lymphocytes are sequestered in the lungs, we can see lymphocytosis. CD4-CD8 ratio is increased. On biopsy, we can see non-cacheating granulomas. On gallium-67 scan, there is increased uptake of gallium in the affected organs. On this scan, as seen in this picture, we can see that certain areas look darkened. In the head, we notice panda sign. The head looks like the image of a panda. There is increased uptake of gallium in nasopharynx, lacrimal glands, and parotids. But the uptake in nasopharynx is purely physiological, and that of lacrimal glands and parotids is pathological. So if a panda sign is seen, you have to suspect sarcoidosis. Then the scan of the chest shows lambda sign. That is, there is increased uptake of gallium on right paratracheal and right and left hilar lymph nodes. This is the panda sign. That is the lambda sign. So to treat the condition, if the patient is asymptomatic, just wait and watch. The condition may resolve spontaneously. If patient is symptomatic, give steroids, hydroxychloroquine, and methotrexate. That's it about sarcoidosis.
I hope you found this video to be informative and concise, and if you want me to make more videos on study topics, please let me know through the comment section. Goodbye.